At the heart of our health service
Hello, Barnsley Emergency Department.
is the overstretched casualty team.
Yeah, here it comes now, look.
Working around the clock under daily stress and strain.
I've had 21 patients in the last hour.
They're on the front line of emergency care.
We've got a 30-year-old overdose.
Right.
Suspected heart attack. Arrival 3 minutes.
On call for our most vulnerable moments.
You just keep your head nice and still for me, lovey, and let us do everything, OK?
Facing life and death.
They're just saying that your lungs are packed up and there's nothing that they can do about it.
Sharing trauma and tears.
What a superhero you were.
With no time to catch their breath, a close-knit team who rely on each other.
Come on, out of my way now, lovely. Some of us have work to do.
To get through the toughest of shifts, day in, day out.
Anybody want anything doing? Fetching, carrying, back massage?
This is Barnsley Casualty 24/7.
Got a soft spot for them all. Although don't tell anybody that, will you?
On shift tonight, consultant Dr. Rob Jones.
You're going to end up with a really impressive bruise over there.
Volunteer Jane Allen.
I see we've got A team on them this morning, Sarah.
Sister Jane Hawksworth.
Sometimes they say to me, oh, you talk a bit posh, but I don't really. It's just that they talk rough.
And consultant Dr. Julian Humphrey.
You're a medical miracle, aren't you? You're a tribute to the NHS.
So get ready to share a shift with the team at Barnsley Casualty.
Can't say a big enough thank you.
Walk as if you're really happy to be here. You know, a bit of a spring, you know. You're happy to see me, aren't you?
Barnsley is ranked in the top 10 for hospital waiting times. It's a record they want to uphold. But today, the casualty team is starting the shift with a backlog of patients.
We have a very busy department with quite a long doctor wait now. We're at 3 hours.
The clock is ticking, as every patient must be treated, discharged or admitted within a 4-hour target.
At the moment there are 39 patients waiting to be seen, with 61 in the department. It is busy. We want to hand it over in a better state for tonight.
The 30 bays surrounding the hub are full of people needing treatment. And to add to the pressure, emergencies keep arriving.
We've had horrendous waits for beds, and it's because the hospital's full.
Pushing the team to hit the 4-hour target are consultants Dr. Julian Humphrey and part-time comedian Dr. Rob Jones.
So did you do any improv this weekend then, Rob? I must come and see you sometime, I really do.
Please do. You're more than welcome.
Do you get heckled? Like you do here?
Not as bad as here. Not as bad as you.
Our relationships within that team are quite paternal, maternal, brotherly, sisterly. Everyone wants to look after each other.
We all have a little hug, don't we? We have a little hug like that before we go. I love you. It's probably because of the things that we see and the things that we go through. And we're there for each other. Come and look at mine. That's why it's so family orientated.
I think I'd be the eccentric uncle, actually.
I'd probably be the really handsome, good-looking brother.
I'd definitely be the one in prison. I'd be the black sheep of the family.
Clocking on to face another demanding shift is advanced nurse practitioner Richard Jackson.
Hell, David, you all right, mate?
How are you?
Not so bad. Is it busy?
It's always busy.
Oh, it's busy. No problem. Everyone has outside hobbies, and for me, it's always been Star Wars, and I like dressing up as a stormtrooper. That is a little bit of a way of offloading.
Go for it. Okay. So, gentleman, it's been there since probably 9 a.m. No obvious injuries, but to range parameters. You'll be 15 minutes, and we'll see you in resus.
Nurse Jackson heads to Resus Bay 1 to treat 82-year-old Ken. He's suffering with shooting pains in his head chest and arm.
1, 2, 3. Hello. Well, that's woken you up.
Ken's wife, Joyce, is with him.
How's that? He's had a stroke 6 years ago. So he's already got a weakness in his left side. He gets pain in there and tingling in the left arm anyway. Yeah. And it was just more so today, and he couldn't put his finger on why. And then we've moved him to the ambulance, and blood pressure's dropped, rests are still up, and then temperature's just gone up like a whole degree. Tried to cannulate him to get some fluids up. His veins are awful.
How you been getting on?
Oh, terrible.
Terrible. When did all this start?
At night.
At night. And you've been coughing as well, have you?
I've got 2 minutes.
Yeah. And are you bringing anything off your chest?
Right. I brought a bit of Remo.
And what colour was that?
I don't know.
You don't know. And have you had any pain in the chest at all, Ken?
Yeah, in his back.
In his lungs, yeah.
In
And,
my back.
and who's this you with?
My wife.
Gaffer.
No, I'm not Gaffer.
And have you had any headaches?
Yeah.
You had some headaches and what?
Well, they're like, no, it's like a ping, like a bee sting.
Like a bee sting, and then goes away, does it?
Yeah.
So you felt pretty rotten then, have you?
Yeah. I was 8-year-old when I knew my husband, and I'm 78. It's a long time, isn't it?
It is.
It was his wedding anniversary last week. 59 years.
Human nature is just a wonderful thing. If you take your time to just stop and watch, there's some really tender, gentle moments in resus. It does make you feel more positive about life. You also realise sometimes life is cruel as well. Good things will happen and bad things will happen.
You'll be okay. I'll look after you.
In the hub of Barnsley A&E, the team are still trying to clear the backlog of patients.
There's 2 waiting to hand over. None can sit out in the waiting room. I've declared a 5-hour wait in that hand it out there. Yeah. And I think 3 people have shifted.
After a week off ill, Sister Benita Wainwright is back on shift.
Oh, what up here? Chest infection. So I went home, didn't I, 2-3 weeks ago on shift, and then come back and then made myself poorly again, and then come back, and Tom just looked at me and went, "What are you doing here?" But then Keely and that did my obs, and my heart rate was 134. My blood pressure was like 100 at systolic. I don't have any family support around me, so these people, they are actually my family. I went home and died for a few days.
But you're feeling much better?
Yeah.
Good.
A lot of them are really close friends, and I wouldn't change any of that.
Sister Wainwright is pushing to ensure every patient is seen within the 4-hour target. But all the bays are full.
You can take cannulas out, Cocker, can't you? Take cannula out for me. She's sat in the waiting room. She can go home.
Oh, Barnsley A&E. A 2-year-old boy. Short of breath. Noisy breathing. If you come straight to resus, we'll have a team waiting for you. OK, thank you. Bye.
Two-year-old Thomas is distressed and struggling to breathe. Dr. Caroline Bird will assist Dr. Jones in resus.
Just air.
I don't want air.
You've got lots of it.
I don't want one.
It just helps you breathe, that's all.
First thing is to realise that you're not treating one person, you're treating mum and dad. For the child, you can put them at ease quite quickly, but you've got to address the anxieties of the people that brought them in as well. And I think that balance is quite hard.
Does he have any allergies to anything? Is she given any medicines regularly?
He doesn't have asthma. It's just the last couple of times he's had this, they gave him an inhaler and said, give it a couple of puffs, so I did that.
My daughter's nearly 4 and my son is 15 months. When you can easily put the face of your child on that child, it's that little bit more difficult.
Yeah, it does sound like a creep. Cat refill time is less than 2. His heart rate's at about 110.
He's probably a moderate croup at the moment, isn't he? And although that's likely to continue to get better, his oxygenation and the fact he has got some stridor at rest means he's going to need a period of observation.
So we're going to give him some medicine called dexamethasone. So that's an oral steroid medicine which helps reduce the swelling in his throat and hopefully helps him with that noise and helps him with his breathing.
Swallow it all. Good boy. Boy, well done.
Oh, Barnsley A&E.
Paramedics are bringing in a fragile 98-year-old woman who's had a fall. Tasked with prioritising new arrivals in the ambulance bay is Sister Jane Hawksworth.
4 minutes ago you arrived.
98-year-old lady walked off the ambulance.
Oh, hello. Are you cold?
98-year-old lady.
Are you cold?
She's had a blanket.
I've done this job for a long time now, in a number of years, and it's got harder over the years because obviously people are living longer.
I know, yeah, 98-year-old.
It can be the most traumatic time for them, but they come in, we look after them, we do the best that we can for them.
She's a fall, head injury on warfarin.
Oh, so she's going to need scanning.
She's got up feeling a little bit woozy, gone to make herself a cup of tea and had a bit of a tumble in the kitchen. So she's got a big, just turn your head, Doris, for me, lovely. And she had a fall a couple of days ago, so she's got all that on her face. She's got a pacemaker in, there's quite a few little bits and bobs going on. Yeah, but in sheltered accommodation.
Have you got a headache? No,
she's
no
she's
pain.
Oh.
No pain anywhere. Got a right bump on your head.
Yes, it's not like it was when I first moved.
It's not like it is when you first did it. Why was it bigger? Was it? Okay. We need to get you onto one of these trolleys because you're going to have to go for a scan on your head. You know, because you're on warfarin, so we just need to check that there's nothing wrong. Doris, you know when you fell, did you knock yourself out?
I didn't knock myself out.
You didn't. Do you have one of those emergency things that you can pull? Yeah. So that's what you did you? And then they came to get you up. Okie doke, sweetie. Cheryl's just requested a CT head on ice for a 98-year-old lady called Doris Bergen. All right, love, I'm just doing some bloods and then I'll bring her round here. Is that all right? Thank you, bye. Do you want another blanket?
I'll be all right.
All right, lovely. I'm just going to leave you here while you go for a picture.
In Resus Bay 1 is Ken, who arrived an hour ago with shooting pains in his head and chest. Nurse Jackson is trying to diagnose his condition.
Ken, your observations are showing that you've got an infection somewhere. I just need to bob a little tube in so I can give you some treatment and take a little bit of blood from you if that's okay.
All right, well, I'm not feeding the needles.
You're not feeding the needles, good job, isn't it? You're not a typical Yorkshire lad with your blood, are you? You're not tight, are you?
Well, yeah.
Yeah.
There's no better than Yorkshire, is there, love?
I don't think so.
Ah, there isn't, no.
As he sounded quite chesty.
It's not being himself. Complained about this big heavy pain in his lung.
Yeah.
Yeah.
Just gonna have a listen to your heart, just breathe normal for me. To click with the patient straight away, you just know you're onto a winner, really. You get that link up with them, it's easy to talk to them, they're giving you good information. And what's it like on his feet?
Oh, unsteady.
Unsteady. What's it like on a good day?
Well, you know, I watch him.
Yeah, and do you have any help at home?
I have carers, but I've got family to help me.
Oh, that's what you need, isn't it?
I have love, yeah.
Ken was a character, he was a lovely bloke, and we did it off straight away. Him and his wife were a very nice couple. I'm going to treat you with some antibiotics, some fluids, do some blood tests, get a chest x-ray. And I think, looking at your numbers, you'll have to stay in hospital today, I'm afraid. OK, let's get cracking, let's get these antibiotics into you.
In the hub are two of the longest-serving members of Barnsley Casualty team, volunteer Jane Allen and Dr Joe Bean.
It's been 10 years since I started in a couple of months.
It only seems like 2 minutes.
I think I look younger, actually. My first introduction to Jane was you just had a party, you just had your mother's wake. Her mum decided that she was going to die soon and that she should have her wake before she died, didn't she?
Yeah, that was 10 years ago. She's still here. She had a big party with Vicar and everybody.
It's time she had another one, because she might know different.
Well, she's 85 this year, so I think we're about due for another wake. Yeah. But she said she'll not be here when she dies, will she? So she'll not know what anybody's got to say about it.
That's it, she wanted to know.
She wanted to know what they were going to say about it now, so we had a party for her. Some of the consultants there started out when they were registrars, etc. And Dr. Bean, she was a young woman, and, you know, 12, 15 years, she's getting older. I'm getting younger, obviously, but they're getting older.
Dr Bean is treating the walk-in patients today. Next to be seen is James, who's been in the department for almost 2 hours.
Okay, that looks fine, so no sign of any glass. We'll just get him stitched when he comes back. My hand picture's really bad. It's not good. It's better if it's the front of the hand because I can draw the nails on, so at least that looks more realistic. You're coming in then.
No glass in it then?
No glass, so that's a good thing. So you've had stitches before, haven't you? Yeah, so just pop a little bit of local anaesthetic in it.
Yeah, I'll sit, numb you up and then...
And numb you up and just a couple of stitches and we'll be good to go. So definitely feel normal there,
so
and feels
that,
okay there.
Yep.
Feels okay and okay there. So tell me what happened.
Just putting the glass down on the table. It broke. Next thing I know, nice piece of glass sticking in my hand.
Just checked, no signs of tendon damage. We can't see any signs of that. So okay, just a sharp scratch that stings a bit.
Yep. Right, needles as well.
Oh, you're the man. I don't think anyone likes needles. You'd be a bit strange, wouldn't you?
Yeah, well, that's it. I look away while you do this.
Yeah, no, don't want.
How long have you done the job for?
I've been in A&E since about 1998, so it's been a long time.
It's a lot more busy at A&E than on the wards, isn't it?
I'd rather be busy.
Well, that's it. Otherwise you'd be bored on the job, wouldn't you? Really?
Yeah. Because when I first worked in A&E, there wasn't the 4-hour time. You know, now we're meant to get everyone in and out.
Yeah, time limits.
In that time limit. The waits used to be awful. So I think people do forget what it was like before we had that. My parents were quite horrified when I first suggested I might be a doctor. They thought it was a really difficult career to go into. The hours are quite long. The pace that I work at now can be pretty intense. Right, so that looks better.
No, it does. And now I can't feel it. It feels going.
Stitches will be out about next Tuesday or Wednesday. If it bleeds through, then get us to come back and we'll change it for you. But it should be fine.
Thank you very
Okay,
much.
hold on there because I'll get the nurses to come and give you a clean. All right?
Okay, thank you.
Just another scar to add to the collection.
In the hub, the team are pushing to get more patients treated and discharged within the 4-hour target.
So there's 30 patients in the department at the minute. There's a couple in resus and quite a few in majors. The hub is just flooding. This guy here, Aidan, Rob Jones is going to pick him up because he's had a weight fall on his head and he's a bit of a mess at the minute. Okay. It looks really bad. From a door.
Dr. Jones is treating Aidan, who was admitted to Bay 8 3 hours ago.
Right, I'm going to inject that now. So this is the worst bit. Probably your head. Is it? Got such a good blood supply, it bleeds a lot. That's why I let it bled so much. Trying to distract you from what I'm doing.
It doesn't help. Not really, yeah.
I think the first time I dealt with head injuries, you feel like someone's bleeding to death in front of you. As you get more experienced and quicker at closing them, you know you can mitigate that by just pressing on it. But equally, you just need to get it closed quickly and then it'll stop bleeding.
This should be the last bit. Okay. Just give that a press. There you go. Is that as painful to press on as it was, or a bit better?
Yeah, I can still feel it, but...
Yeah. So just turn your head slightly towards me. I can't see anything deeper damaged than the skin, so that's good. How's that?
I can't feel anything. How many stitches, you think?
It's always one of those things you don't really know until you start. But you get away with 5 or less, I'd be surprised.
I've never really been squeamish. I don't mind blood, I don't mind vomit, I don't mind a bit of poo even. It's probably the emotional stuff that worries me a bit more.
You alright if I carry on?
Yeah, just carry on, yeah, it's fine. It's less than that needle, so...
Is it? Okay, yeah. I think we're done. Actually, I think you got away with 1, 2, 3, 5. Gonna end up with a really impressive bruise under there.
A scar as well.
Yeah, so anytime you get a cut, you get a scar. That's done the trick.
Good. Nice one, thank you very much.
Okay, and then we'll sort your mouth out, okay? So, pop your head back for me. Halfway through the tooth there's a clear crack, and whether that extends into the root or not, I'm not sure. And then you've got a cut on your lip, probably pretty easy to sort out, but they may as well see you to sort out the whole thing.
Aidan can now be discharged from A&E and transferred to a clinic for further treatment. Dr. Jones moves straight on to his next patient.
Joshua Moore, please. Hey, follow me. Right. I'm Dr. Jones. Nice to meet you. Just start from the beginning, if that's okay.
Yeah, about 2 weeks ago, underneath my nose. I'm getting headaches like pretty much every day from then, but not constant. But ever since Sunday afternoon, just gone. It's just been constant, like every day. Day and night, waking up through night as well. So this morning I started vomiting.
How many times do you think you've been sick now?
Just twice today. So.
And today's the first time you've actually been sick?
Yeah.
Okay. No nosebleeds or anything?
No, not since I did it. So.
Fine. Okay. We'll have a good look at you, and then it sounds like we probably need to get a scan sorted of your head. But,
There are always those patients that you're... the moment you meet them, they're very, very high risk. The nuances of it sometimes just prick your ears and make you stop to think.
Josh's parents wait anxiously for a diagnosis.
It's not a nice experience, but hopefully get results if that's what's causing pain.
I have 2 concerns. One, that you've hit your face and your head, and then got progressive headaches, and whether that's caused anything. And the other concern is that actually there was quite a distance between you hitting your nose and then that sudden headache, and we don't want to be missing something else that's happening. So if you have bleeding inside the head for medical reasons, then that can be a sudden onset headache, and we don't want, you know, the red herring of your nose injury to sort of mask that. Okay. So if you hold tight here, I'll just go and organise that scan, and I'll let you know when that is. Right.
For Dr. Jones, it's not just the 4-hour target adding pressure. If Josh has a bleed on the brain, every minute is critical.
Most people with a headache will feel disorientated, drowsy, unwell, but vomiting in particular concerns me, and the fact that this chap's headaches come on so rapidly and a distance after the injury, there's just a couple of symptoms that makes you a bit more alert.
quite a worry. I mean, just want to get it sorted and find out, you know, why he's having these headaches.
After a manic start to the shift, the team at Barnsley Casualty have managed to clear the backlog of patients.
There's really not much for me to do, Danny, and it's that word what we're not going to say.
So quiet today.
You dare? Why would you do that? Why would you do that when I'm in resource? That is not fair.
Quiet. It's that word, we don't say quiet. No, can't never say that word.
I mean, you've already said it now, so...
I know, it had just come out there. We don't use the Q word here.
No way. Do not say the Q word. Yeah, you're in trouble. Because odds on, once you've said it, doors will fling open and there'll be 18 ambulances stood outside, all waiting to come in. As soon as you've said quiet, that's it. Sod's law.
Hello, Barnsley A&E. Yep, 90-year-old male, chest pain. All right, if you want to bring him to the hub and we'll go from there. All right, cheers.
Within minutes of saying it's quiet, the casualty bays start filling up again. Dr. Julian Humphrey is called to the assessment bay to treat 90-year-old Jack, who has symptoms of a heart attack.
Did your daughter ring the doctors and tell them that
Yes.
you'd been having chest pain?
Yes.
The chest pain that you've been having, when did you have it? Today or yesterday?
Yesterday. It was slightly yesterday.
And does it feel like a pressure on your chest?
That's it.
Right.
I got off my side and
Yeah.
laid on my back.
Right.
I laid on the other side because of pain.
Now-
to see if I could ease it.
Were you a minor? That's the other thing I
Yes.
need to know. Right, you
Yes.
were a minor, okay.
Yeah.
Right, how many years were you down the pit?
Going into 40 years.
And did you get any compensation for your chest or anything like that?
No, for my back.
Just for your back?
For my back.
Right. You had an accident down the pit, did you?
Yeah.
We see a lot of miners. That ethic, that hard-working, Yorkshire grit, I think comes across in the way that these patients talk to you or have this sort of very stoical attitude. This group, slowly but surely, are actually dwindling down now.
Bowel cancer.
As well?
Aye.
Right, you're a medical miracle, aren't you?
Yeah, aye.
You're tribute to the NHS.
I played for England at Darts.
Did you?
I played for the county.
Right, how many layers of clothes have you got on there?
I've got a long sleeve t-shirt.
Right.
And I've got a shirt.
I need to get to your heart, so I want to have a quick listen to it, if you don't mind. Right, well that scar's healed up quite nicely, hasn't it? Just relax, let me have a quick listen to your heart. Right. Now, this pain that you're getting, does it feel like it's across your chest, like a pressure?
Just there.
And does it... Right.
About there.
Does it hurt when I press on your chest at all?
Keep pressing.
Right. With your heart being a little bit diseased, we're going to need to just check it over, okay? That's what your doctor wanted, I would imagine. We'll do another tracing of your heart, and we'll take some blood from you, okay? He's a character, isn't he? I don't know if you saw, but he put his fist to his chest, and that's one of the classic signs that it's pressure there, and that's possibly from angina type pain.
Doris, scan's fine, so I think she can be discharged now once that's been sorted.
Your hat.
In Resus Bay 4, Dr. Jones is assessing Thomas's response to medication to help him breathe.
Hey, dude. What toys have you managed to pilfer?
Oh, what?
Smiles, that's good. Is he as noisy as he was at home?
No.
No. Thomas, can you just lift your head up for me? I won't tickle you, I promise.
That's a good boy.
Son.
Yeah, that's all right, isn't it? That's doing well. Can I have a listen to your chest, mister?
Dad.
Did you have any dinner tonight, Thomas?
Not much. I didn't really want to eat much, did
So
you?
there's nothing in this belly?
Just had a few bits of sausage.
There's a sausage in there. I can feel a sausage. Just there.
Yeah, tiny little bit of sausage.
You're still a bit croaky, aren't you, as well? Okay, you're doing really well.
So
That medicine's working.
yeah, up there.
So I think we're all a bit less worried about it now.
Yes.
I enjoy looking after kids. I enjoy the fact that most of them seem to like me. Some of them are better judges of character than others and don't like me. But yeah, no, on the whole, I think it's a good thing to be doing.
Given that you can still hear a bit of that strider when he's not doing anything at the moment, we're probably looking at keeping hold of him overnight. But if the strider goes away and he's really, really happy, and you're really, really happy, more importantly, then you could potentially go home.
We got Joshua Moore's notes somewhere.
Dr. Jones is busy with Thomas, but his other patient, Josh, has been in the department for nearly 4 hours. With the results of his head scan back, Dr. Bean takes on Josh's case.
Hi, is it Joshua? Hi, let's just pull you into here, all right. Hi, my name's Dr. Bean, I'm one of the consultants. The doctor who saw you earlier was a bit worried that the severe headache might be related to a small bleed in your brain. We can't see that on the scan, but that doesn't rule that out. So the plan is now to get you admitted up onto the medical ward upstairs. I think we'll probably want to do a lumbar puncture just to double check. So that should be happening fairly soon, okay? Sorry it's been a bit of a wait.
Josh will be admitted to another department for further treatment.
I've had a lumbar puncture before. It's not nice. Oh, it's just like a bottom of your spine, a needle.
Enjoy. Give me a pizza
In Resus Bay 1, Ken is still in a critical condition.
Ken, I've arranged for a chest x-ray. They'll come and do that now. Have some antibiotics and fluids. I'm just seeing a patient out in the department. I want to finish off with them, then come back, write your notes and have a look at you and see how you're feeling after some treatments, Connie, okay?
I've just come to do a chest x-ray on you, Kenneth. Just going to push you up.
My job is to hunt for the life-threatening conditions, to find the diseases that are going to affect life and limb. And that's the driving force. If you like puzzles and games, then emergency medicine is probably for you, really. The chest x-ray does suggest you might have a bit of infection.
Yeah.
The antibiotics I've given you will cover chest, urine and a few other places as well. OK, but we'll keep an eye on you and get you up to the ward as soon as we can, all right?
All right.
All right, Ken, I'll see you in a bit.
In the hub, Sister Rachel Wilkes is halfway through her shift.
Are you squeamish, Rachel?
Not really. The thing that I don't like is sputum, you know, when they're coughing up, dark green sputum and things.
Sister Wilkes is monitoring Steve and his wife Gail in Resus Bay 3, following a high-speed road crash.
Right then, Stephen.
Steve was admitted 3 hours ago and is waiting for x-ray results of his chest and legs.
Started off, we're just off to the shops, just normal Sunday food shopping and normal. We go down that route every time.
And this vehicle just come from nowhere. We're going at speed and just hit his head on and rolled the car 3 times.
I think it's just shock that know that we have actually survived it.
But we're here to tell tale.
It's very important to listen to patients because they've just gone through a road traffic accident. It's not an everyday occurrence for them. They are scared, they are shocked. Let them get it off the chest.
Thankfully, them people pulled us out. Can't say a big enough thank you.
Shows you the good people of Barnsley, innit?
There's only a couple of hours left of what has been a very demanding shift.
Hey, John, how are we doing?
The team have pulled together to treat over 100 patients, all within the 4-hour target time. Next to be seen is Mrs. Brown in Bay 3.
There's a Mrs. B in there for you. Mrs. B in room 3. Mrs. B in room 3.
Well, Mrs. Brown is a term that's used when the tea trolley has been admitted to one of the cubicles. It's a way of making everybody smile and, right, okay, we'll have a little break.
All right, ladies.
It's not going to look right good for us, though, is it?
I didn't know what it was, though, when I first come to Barnsley. I was like, when they were like, Mrs. Brown's in room 3, I'm thinking, what, does she need some set of obs doing? I had no idea, like, it actually meant a cup of tea.
There's some
tea or coffee?
Teas.
Sneaking them down back.
Are you a coffee drinker?
No, I'm not, no.
Oh, you're all right then, aren't you? Have you brought your own, Katie?
I am, look at that.
We love a Mrs. Brown. That's the best thing, Mrs. Brown.
Cheers!
In the hub, Dr. Dovrig Hughes is reviewing the scan of 60-year-old Steve, who arrived in resus over 3 hours ago.
He's had quite a bit of pain in his neck, so we've CT'd him.
He's checking the scans for any fractures after Steve was involved in a high-speed car crash.
I think it looks fine. It's been reported. I've scanned his abdomen and his pelvis as well. I think the radiologists have said that's fine. I think he's been quite lucky. We've seen your scans. Everything's fine. Little bits of glass to get out. I just need to have a quick look at your back.
It's my knee. It's absolutely killing me.
Nothing on the back there. It's fine. Okay, back you go. Okay, so we've not found anything wrong inside your head. Nothing wrong with your neck. Chest looks fine. Your chest X-ray's fine. The scan of your belly's fine. There's that bruise. Surgeon will have another look now. Your arms are fine. So it's just that leg. So we haven't found anything. There's nothing terribly out of place on the X-rays. If you're comfortable, we can get you home. If you're in just too much discomfort to manage, then we'll keep you until you're a bit more comfortable.
Yeah.
Could have been worse.
Could have been dead. All right, then. Thanks a lot.
I'm going to head home shortly, and with a bit of luck you are as well.
Well, hopefully.
You should be okay for your holiday.
That's what I thought. Well, I'm going to get off for my 60th, but should be doing now.
So I'm just going to give your
I
face
think
and
I've
head a
got
little clean.
Some bits still stuck around on the top.
Just tell me if anything hurts. It's a very vulnerable time for patients because it's always unexpected why they've come in. You know, it's nothing that they've planned. They've probably got up that morning and didn't expect to attend A&E that day.
That's all you need, 5 days before your 60th.
Oh, you remember it, won't you?
Well, obviously something like that, you just think, well, I'm lucky to be alive.
Definitely. Could have been a lot worse, couldn't it? Could have definitely been a different story. You do look a bit better now. You've got all that blood off your face.
My foot's, it's still really painful.
Is it? Right, okay, so it's going to be quite sore then, isn't it, for a little while?
Every bone in my body aches. I've dislocated my finger. I had to have all my wedding rings cut off and everything.
It's a good job we did it because your hands look more swollen. They can be mended, love. They'll be like new.
Steve is discharged just before breaching the 4-hour target.
Right.
Okay.
Okay then, thanks a lot.
All right, Gail, take care, love, and enjoy your birthday in Benidorm.
I will.
People in Barnsley are funny, though.
They are. They're so funny.
They're funny.
They're so funny. They're so dry, and they can just take you out with one little comment. I think I have a very Yorkshire sense of humour, actually. And the Yorkshiremen are quite mocking of each other, but I haven't developed a Yorkshire accent. I don't think I've developed a Yorkshire accent anyway.
8 hours in and a dozen patients seen. Nurse Catherine Ravensdale is treating the walk-in wounded as quickly as she can.
We've got Neville Smith. Come on round. Go and take a seat. Right then, so I'm Catherine, I'm one of the nurses.
Hey.
Hiya. Right then. What's brought you here today?
I got drunk yesterday and ended up fighting with my son, and he's stamped on my collarbone.
Okay.
I don't think he's meant to do it, I think he's lashed out and just, you know.
Is it more like a hit or did he chew a stamp on you with his foot?
It's like a stamp out, it felt,
Okay.
because I was in contact with the floor. We really went out for a couple, but I ended up getting right on it. It feels like it's crunching and cracking, and I think it's definitely broke.
Just undress you while I'm here.
Yeah.
Does that feel okay? It's not
Yeah,
painful.
to be fair, it's not that bad now.
It's just here, isn't it? You can see it bruising here on your chest. That's fine. Every day is always different. I just think to myself, all right. You think till you've heard it all, but then you don't. The belly's rumbling there, I do apologise. Couldn't hear my belly rumbling. I'm not that afraid, to be fair. And have you taken any pain relief?
No, some ibuprofen this morning.
And what time did you take ibuprofen?
Oh, it was about 7 o'clock.
Are you wanting any further pain relief from
Yeah,
yourself
please.
today? You're just trying to pick out the facts of what actually happened, because them facts are what you need, and a doctor looks at that and they don't want to know that they've been involved with a altercation at home. They just want to know the simple facts on what's actually been injured rather than anything else, really.
He's 20. I'm not sure if I say 21.
You don't normally lash out, do you then?
No.
Kind of one off.
We've had a couple of
have you?
days like that.
Neville will be scanned and treated before being discharged. As Dr. Humphrey's shift nears its end, he's keen to get 90-year-old Jack home as soon as possible.
Right, so he's got trifascicular block on there, which is first-degree heart block plus left bundle branch block. Normally, patients who have that rhythm need a pacemaker, but he's not describing any syncopes. Right, young man, why don't you come back and sit down and I'll have a little chat with you. You're watching the world go by, are you? Sorry, you can sit on that chair if you want. It definitely isn't your heart, all right?
No.
As I say, if it's not your heart, then what we call is not specific, so we don't know quite what it is. So we're going to let you go home, all right?
I'm going in and have my daily paper to read when I get home.
Yeah, and I'm just going to speak to the nurse and we'll get you up to the discharge lounge, all right?
Sure. Right. Thank you very much.
Okay.
Thank you.
One of the things about minders, and in general Barnsley people, is they're extremely respectful to doctors. Thank you for helping me. Thank you, doctor. That's one of the things that does make me proud to work in Barnsley, actually, that recognition of what you do.
As Jack is discharged, the day shift ends for the team of Barnsley Casualty.
This hospital is very, very, very good. The staff, you know, and the amenities are, it's very good.
I haven't got, you know, a millimetre of regret. No regret at all about choosing emergency medicine as a career.
The good points to A&E are you can make such a massive, massive difference and be part of that relationship. You can't put it into words, it's brilliant.
This department is not about any single person. We are a team. I couldn't do my job if it wasn't for every single one of them.
It can be so rewarding to work in A&E, and if I can make a little difference to somebody, then that's my reward, thank you.
For the day shift, it's home time, but the doors of Barnsley Casualty stay open 24/7.